Good afternoon, our dear friends. Maayong hapon to our fellow Iliganons who are watching this webinar to know more about the different aspects of the COVID-19 pandemic. Welcome to our forum, and we are here just to give you the facts. The title of our webinar is COVID-19, Virus, Variants, Vaccine, and Home Care. I am Dr. Jun Ruiz, a Philippine and American board-certified gastroenterologist from the Medical City, a strong advocate for colorectal cancer screening, an author, an occasional journalist, and most of all, an Iliganan. Our esteemed speaker is Dr. Eric Tayag. He graduated from the University of the East Ramon Magsaysay Memorial Medical Center. He is currently the Director 4 of the Knowledge Management and Information Technology Service of the Department of Health. In addition, he is the DOH Freedom of Information Champion. His career is focused on public health, especially on infectious diseases, epidemiology, and universal health care. He has held key positions with the Department of Health for the past 30 years, including former Assistant Secretary of Health and former spokesperson. He is also a former president of the Philippine Society for Microbiology and Infectious Disease and the Philippine Foundation for Vaccination. He is dubbed as the DOH Dancing Doctor. It is with great honor and privilege that I present Dr. Eric Tayag from the Department of Health.
Thank you, Dr. Tayag, for presenting such an excellent, comprehensive, and provocative lecture, giving us the current status of the situation of COVID-19, the invisible enemy that we have. Let us give Dr. Eric Tayag a big round of applause. To our viewers, especially in the city of Iligan, I would like to greet you maayong hapon sa inyong tanan diha sa dakbayan sa Iligan. Dako kayong kalipay na nakauban kamo kanamo kay daghan kay tay natun-an og nasayran bahin sa COVID-19. Nagpasalamat ako sa inyo na nakauban kamo kanamo diri sa among webinar ngayong hapon. Okay? As they say, knowledge is power. I am sure everyone enjoyed Dr. Tayag's talk as much as I did. And we are really lucky that we have a high-profile public health authority speak before the citizens of Iligan City. Before I forget, let me just recognize the Department of Health, where Dr. Tayag is the Director for, and the Medical City for the videos that we showed during the countdown. I know there are burning questions from our viewers, and let us now go to the question and answer portion. On behalf of the organizers and Iligan Nation, I would like to thank Dr. Tayag for accepting the invitation despite his heavy schedule. Now, let us bring Dr. Tayag back. Let Dr. Eric Tayag please welcome to our webinar.
So, good afternoon, dyan sa Iligan. But before we start, I'd like to thank Newtech Pulp Incorporated, okay, led by Polly De Los Santos. Magandang hapon. Madam Petra Burcia and Engineer Albert Monasque, and of course to you, Dr. Jun Ruiz. Good afternoon, and thank you for introducing the topic. And I was happy you enjoyed my presentation. Now, here comes the hard part, your questions.
Okay, so thank you, Dr. Eric, again. Now let us go to our question and answer portion. Are you ready, Dr. Eric? Game ka na ba?
Game na!
Oh. So I think we will start our question and answer with a bang. Okay, so the first question is, the Department of Health has been at the center of the government efforts for pandemic control in the last 18 months. And we have heard very public disagreements between physician groups like PCP and HPAC and the government's IATF regarding policies. From your key position from the Department of Health, looking back in the last 2 years, what do you think were the best strategies that the government implemented, and maybe they were controversial at the time of implementation, and at the same time, what aspect of pandemic control can we actually improve on? Dr. Eric?
Okay, those are very loaded questions, June. But first, I'd like to start that, well, while there were disagreements between different parties, we are still united against our fight in this pandemic. Of course, there are many silver lining in this pandemic. For example, when the Department of Health introduced telemedicine, this allowed the public individuals who are so anxious to access because of the disrupted health services. And so we had a DOH COVID 19 hotline 1555. It still is available initially on a 24/7 basis. We provide teleconsultations and it has been rolled out in many parts of the country. So that is one silver lining. Well, if everyone remembers, you actually wait for the number of new cases or deaths. That's every day. And we are able to provide you the data because we have IT applications and tools that allow us to gather and collect this data and report them to you. Of course, there have been snafus when we report. Sometimes we beg the indulgence. We apologize if the numbers are not coming in as fast as we can. And of course, we were able to ramp up the testing. Did you know, for example, June, when we started the pandemic in February, when we reported the first cases, it was only the Research Institute for Tropical Medicine. That's our laboratory. And in a single month, we were able to establish 17 sub-national laboratories. And right now, did you know that there are 287 accredited lab testing? But I got information that in Iligan City, you still have to bring your samples to Cagayan de Oro. You're still waiting for an RT-PCR laboratory. So that is one of those we need to improve. There are actually June 34 provinces in the country that don't have this RT-PCR laboratory. But if you will recall, antigen testing was recommended in areas where RT-PCR testing is not available. And of course, we were able to enforce quarantine and isolation procedures. We have temporary treatment monitoring facilities. And this was, of course, to allow those who cannot be quarantined at home because of the conditions at home so that they actually have a quarantine facility, especially for our overseas Filipino workers who had to stay for a few days before they are actually released from quarantine. So that's a good one. Now, what we would have improved satisfactorily would have been the contact tracing. This has been something that required human resources because we needed the tracers. Not all local governments were able to provide the tracers. And what's critical here is that we introduced apps, but it did not gain a foothold as much as we wanted to, June. So I think I'll stop at that. And we have to count our blessings. And the biggest one is that we were able to start our vaccination last March 1. Our frontline health workers, all of them, almost all of them have been vaccinated, our senior citizens, and we hope that you there in Iligan City got your vaccines. We have so many to thank for. The supplies are coming in. I understand that there's an even distribution of the vaccines, but we are working on it so that you get the needed supplies.
Thank you, Dr. Eric, for those wonderful answers. And let me just update you. I know last night when we talked about the RT-PCR COVID laboratory here in Iligan, which has been In one almost a year in the planning, I was just told that we already have it open. It opened 2 days ago. So congratulations. And
Congratulations.
so good news for us today during the webinar. The other thing I would probably would like to follow up, I think one of the maybe the issues that I actually wrote when I actually wrote an article for ABS-CBN website. This was in August 2020, barely 6 months into the pandemic. And I did cite, the things that we were really doing well in pandemic control. At the same time, things that we needed to improve on. And I think at that time, the main issues were the use of the rapid antibody testing, in which we were actually having a lot of false negatives. So I think that may have contributed to the migration and spread of infection into the provinces, since the persons that were being tested negative for the antibody were actually positive, and they were bringing it to their family and friends in the provinces. And the other thing, as you mentioned, and I cited in my article, is even Mayor Magalong. At that time, this is 6 months after the pandemic, the contact tracing by the LGUs was not really very good at that time. Now, I think we have a very good contact tracing at this time. And the other thing I wanted to find out, I think early on during the pandemic, we didn't have a lot of isolation and quarantine facilities, but we do have a lot now. So I think we have, I think the government has done a lot for us. And I think these are the things that we should be thankful for. And as Dr. Eric said, there are things that we can improve on. Do you have any other follow-up advice or information, Dr. Eric, for us before we move to the next question?
Well, I was informed that there was a tight supply of some of those that you actually required, and I hope that the Iligan City local government has taken its responsibility to make sure that these are available.
Okay. Thank you very much. So that was a very exciting discussion. So moving on, looking at the COVID-19 statistics of the DOH that you presented during this lecture, we can see a clear difference between last month's data, which was September, in which we have the peak of the Delta variant, in which we were having more than 20,000 cases a day. And actually, I think it was 26,303 on 9/11, a very symbolic date. 9/11, we had the peak of 26,303 new cases. However, during the last 2 weeks, it is a different story. And this is not just in Metro Manila. We're seeing in the entire provinces and even in Region 10, where we have the cities of Iligan and Cagayan de Oro. And I was a little bit baffled. The government did not really impose any stricter measures last month. And as a matter of fact, I think we were a little bit more loose compared to the early part of the pandemic. And I've seen a lot of people in the malls compared to last year. And also at this time, people are developing pandemic fatigue. So they're not really following, the minimum health standards as they should compared to last year. But then we have this improvement in the last 2 weeks. So what do you think is the driver or drivers that led to the improvement in the reduction of the number of cases in the recent weeks? Dr. Eric?
Maybe, June, I will begin by understanding why there was a surge. There were four factors. The first factor was, of course, the Delta variant because of its increased transmissibility, as I presented earlier. The second one, and which I also presented, was about social mixing. So you said there was fatigue and everybody wanted to get out, especially those who were very confident because they had the full doses of their vaccine. The third one is about the not so strict enforcement of the public health measures. Just like you said, you see so many people, maybe some of them are forgetting to wear their mask on. So this may have contributed to the surge. And the last one, of course, there was an even distribution of the vaccine. Now, the decrease apparently should be related to this, but I want the people to understand that when there's a new pathogen, the SARS-CoV-2 and its variants, okay, every one of us is susceptible. Ang ibig ko sabihin, lahat tayo pwedeng mahawa. So it can be a newborn or the very old persons among us. Now, what happens is if we catch it, okay, as I explained in my presentation, you get a natural infection, you recover, you develop antibodies, especially if we have an intact immune system. Now, couple that plus vaccination, then we have groups of people who are less likely to get another infection or to get a new infection. So the virus therefore behaves so that it's not even transmitted as efficiently as it should. Now, this happens because of vaccination. This happens because we actually do not socialize as much as we can. So even if there were no strict enforcement, but individuals followed the guidelines, if you're sick, stay home. Don't ask anyone to come to your homes. You wear your mask when you go out. So we can say that this can actually contribute to the falling numbers of cases. But there's a caveat. Okay, if we are not testing, how would we know?
Mm-hmm.
So that's why we are monitoring the positivity rates for testing. The cutoff is 5%. So if it's not 5%, either there are more people who are not getting tested, so we are actually under-reporting the number of cases. So that's the caveat. And now that Iligan City has its own RT-PCR, we hope that those who are suspected to have an illness compatible with COVID-19 or those who got exposed, that you follow the testing guidelines and get tested. Okay, so we cannot be complacent while it's falling down. Remember, in the past, this is a third peak. It can easily go up, so that's why we have to be very vigilant.
Thank you, Dr. Eric. I'm so happy that we're actually seeing the effects of vaccination because for a while, a lot of people are thinking that we will only see the effects once we reach into herd immunity, which is a little bit far away from where we are right now. I guess the other question, Dr. Eric, which as a follow-up, do you think this can be sustained in the next weeks or months?
Okay, the question whether we're able to sustain there's going to be a continuous fall in the numbers. Yesterday, for example, the Department of Health reported less than 4,000 cases, and we hope that in the next few weeks we'll reach our new threshold of less than 1,000 cases. That will be a very good holiday celebration. We'll have a very joyful Christmas, and let's keep our fingers crossed. We should work together to make sure, especially there in Iligan, that you're able to ramp up your vaccination now that we have started vaccinating the adolescents. We hope that before the year ends, you can start also vaccinating the adolescents.
Thank you, Dr. Eric. You did mention that the acceptable positivity rate by the WHO is 5%, right? I think during the surge of the Delta, I think our positivity rate was around 25 to 30%. So I think we were not really testing enough at that time, and maybe the new cases were probably more between 30 to 35,000 a day, don't you think?
Yes, we kind of suspected this was underreported. Basically, that people may have the wrong notion that they have to pay so much for their testing, forgetting that the PhilHealth has a benefit package for testing. And so, therefore, please don't lose that opportunity to get tested because PhilHealth actually covers for that. And of course, there are people, and I received their stories that actually don't want to know their COVID
Mm.
status. So they just don't want to know. So they just stayed home, followed protocol so they cannot spread it. They suspected it, but they didn't want to know. And you know why? In some areas there was a strong stigmatization or discrimination, especially in areas wherein the local government units have not been respectful of the rights, and they even screen the results, and so the neighbors get anxious if there is a household that's near to them and it has been tagged having positive household members. And so when this happens, the others would just, oh, we better not have ourselves tested. This my the our neighbors might discriminate against us, and we were kind of uh, satisfied that as weeks went on, that this was not happening anymore, especially when we ramped up the vaccination.
Thank you, Dr. Eric, for that information that you could actually have PhilHealth covered for your diagnostic test for the RT-PCR. So now I think our next question will be more focusing on the city of Iligan. So looking at the figures of Iligan City from September, which was presented during one of the UP College of Medicine webinars by the lone ID specialist, Dr. Lionel Quitos, and looking at the figures that Dr. Tayag presented during this lecture, looking in September when we had the surge, Dr. Quitos in his talk was able to reveal that I think our healthcare system was very vulnerable at that time. As a matter of fact, he presented this data, and let me quote, that the city reached a critical 94% bed occupancy of 136 beds, when at that time there were 1,014 cases. So you only have 136 beds, 94% are occupied, but you actually have 1,014 active cases. Sadly, there were only 6 ventilators or breathing machine, and the population of Iligan is 374,000. And at that time, when he presented the data, the death rate was 7.36%, while the national average is 1.5%. So what I did after listening to your lecture, I recalculated the death rate, and it's still a scary 4.2%. And the good news is after a year of preparation, now we have the RT-PCR lab, which just started 2 days ago. So it's very good that people will know that it is now available in the city of Iligan. So though the tide may have turned for the city of Iligan, it did expose this fragile state. As part of the DOH, what can you suggest to our city health administrators, or what can the national DOH offer to assist the city of Iligan? Dr. Eric?
June, in fact, in Lanao del Norte, although administratively Iligan City is separate, the contribution of COVID cases from Iligan was actually two-thirds. It's about 68.9%. And yes, it's the case fatality rate, the number of deaths over the total number of cases. When I did my own calculations, it's actually 4.5%, which is actually 3 times the national average now of 1.5%. And in my presentation, I also provided you information just over a week ago that your ICU rate is 53%. So that actually implies that you don't have enough resources in Iligan City, and the number of ventilators you mentioned tells the story. Okay, and of course, in the first 17 days of October, and this was good news for Iligan, there was actually less than one death every day in Iligan. So I really don't know what Iligan did, but I can surmise that you actually stepped up because the numbers were not bad. So
Mhm.
this is one example, June, that if you have data, you make decisions so you can actually make sure that you don't fail and it doesn't get worse. So when everybody works at this, and when everybody makes sure, I don't know if telemedicine has been established there. It's possible that you don't have a very virulent strain of the SARS-CoV-2. That's one. Two, like clockwork, your health providers have actually did not lose sight of what they have exactly they have to do. So you have your heroes, okay, holding together, making sure that nobody breaks the line. That actually, while the dire situation will not allow them to work as efficiently as they can, but they did. And then you had to work with other local governments. Okay, that reflects a better planning from Iligan City, and I hope it stays that way. And while it is all quiet in the Western Front, please ramp up your vaccination. So the local leaders there in Iligan, okay, uh, make noise, make noise in the national government so that you get the vaccines as fast as you can, and then vaccinate everyone. And we hope that the vaccine confidence is not a problem there in Iligan.
Okay. Thank you, Dr. Eric. I think we need to at least thank our government, our healthcare workers in Iligan, and everybody for, I'm sure everybody contributed to this improvement over the last 2 or 3 weeks compared to the surge. So may I go to the next question? As you said in your lecture, there is a global moratorium by the WHO on giving booster doses till the end of this year. And there has been several analyses that indicate that the gain is much higher if you vaccinate the high-risk people who are still waiting for the first dose rather than giving boosters to fully vaccinated people. Okay, and I think this what is also important is the principle of equity. However, we have countries like the U.S., the U.K., the Middle East, and some of the Asian countries. They already started giving booster doses, but I'm sure supply is not an issue with them. We haven't even started giving boosters to high risk immunocompromised patients here. So I have been asked by a lot of people, including friends and patients, who are already fully vaccinated. Thanks to the government, they are fully vaccinated. However, they have belated access to American vaccines like Moderna or Pfizer, which was bought by their companies. So either the private company bought those vaccines and they came much later, or they paid out of pocket, and they're asking us, should I take this vaccine? Since I paid anyway, my company paid for it, but I already got Sinovac. I already got, Pfizer or Astra. So how will we advise this? I'm sure there's a number of people who are in this situation. They have an access to a possible third shot. Dr. Eric.
Of course, the news will actually influence your decision, especially that in the United States, they did not only approve booster shots, but they actually also improve mix and match. That means that anyone who have completed their doses of Pfizer, Moderna, or Johnson can have a booster dose 6 months after the last dose. Okay, and this will be their booster doses. Initially, the recommendation was only for 65 years old and above. especially those immunocompromised. But the Centers for Disease Control changed their tack and included 18 years and above as long as there's evidence that you are actually very high risk for exposures to COVID-19, especially the Delta variant. This news to us would lead to a demand for boosters. Okay, so let me explain. The boosters are needed because antibodies will wane over time. This was anticipated. But the WHO argued that for equity, we should provide the first doses to those who remain unvaccinated. If we had all the supplies, yes, and that's why in these countries they're starting their boosters because they have enough supplies. And this has been tagged as a horrible act by many poor countries or even low middle countries. We have not followed suit. In the United States, there is what they call a third dose. These are for those who receive Pfizer but remain immunocompromised. For example, those with cancers undergoing treatment. And so it's not expected that they have produced antibodies even after 2 doses of Pfizer vaccine. And so they recommended another Pfizer dose 28 days after the second dose. That's not a booster, that's a third dose. We don't have the same recommendation here. But word goes around that many Filipinos are actually trying to access vaccines for their booster doses. But please remember, your recommendations is 6 months after. Secondly, there's no recommendation yet here. So please don't be part of the problem. If you get those booster doses, you actually deprive a Filipino of getting their first dose. So please don't. And there may be consequences. Because if you use the wrong vaccine, okay, and the effects are uncertain up to now, you will add into the problem. Because, for example, if something bad happens because of these premature booster doses, this may affect vaccine confidence again. So please don't.
Thank you very much, Dr. Eric, for those great advice. So I think if you are in this situation, you really need to talk to your doctor. And I've heard some people, they will just go to another LGU and try to lie their way that they haven't been vaccinated so they could get another vaccine in another LGU. So a little bit unfortunate that it's actually happening. May I ask about, I think you did mention, Dr. Eric, about the antibodies waning after 6 months. And it has been reported in a lot of scientific studies that after 6 months after the last vaccination, and I think it was studies from Israel, that the antibody level started dropping, and that was the reason why they started recommending a booster shot. However, when I actually listened to one of the webinars that we sponsored a couple of months ago, the speaker was actually telling us that, which is actually I definitely agree with. Number one, if we do measure the antibody level, it doesn't really necessarily mean that the antibody is not there, because usually when you get exposed to the virus again or to the pathogen, the antibody level will just shoot up. Or the other thing is there's really no recommended level anyway at this early, which antibody level is actually, protective or non-protective. And the other point that she pointed out is immunity is not just dependent on antibodies. There is also a cell-mediated immunity, which is not measured by the antibody level. So what are your thoughts on this, Dr. Eric?
Well, what you've mentioned is science, but people are governed by their decisions when emotions takes over. Okay, takes over any science. So for many who were actually fearful that if they don't get the boosters, something bad will happen. So they insist on the boosters.
Okay, thank you, Dr. Eric, for that additional explanation. At this point, I will call on our Q&A facilitator. She is a full-blooded Iliganon. She is born and raised here in Iligan. She is an alumna of La Salle Academy. She is the head of HR of Newtech Pulp Incorporated, and this is her project. She is our prime mover for this webinar. Let us welcome Miss Polly Valera de los Santos. Hi, Polly. Welcome. Hi, Polly.
Good afternoon.
Hi, Polly. Good afternoon.
Hi, Polly.
Dr. Jun, thank you.
And I think
Dr.
you
Tayag.
and I think you have more. You have a lot of questions from our viewers, right? So
Yeah, I have.
let's
Yes.
go.
Yeah. Okay, Dr. Tayag, we have one question here for the vaccines for the 17 years old and below. When are they going to be vaccinated for the minors?
We already started a week ago, at least for 8 hospitals. That's for the 12 to 17 years old. But it's limited to those with the comorbidities. And we have 11 of them. So, for example, if the adolescent is obese, they can actually get the vaccine. But it's been piloted in the National Capital Region. And now, from the 8 hospitals, these were expanded to many more hospitals for each of the city or municipality in the National Capital Region. So we hope that those 12 to 17 will get their vaccines. And we hope that before the year ends, Iligan will start your vaccination among adolescents.
Thank you. A lot of our employees in Newtech Pulp are asking for this, and maybe because they wanted now to have the face-to-face classes for their children. So another question, Dr. Tayag, this is also coming from our employees, that on the quarantine issues, like when you come from incoming passengers from abroad, why do we need to have the 7 to 10 days quarantine while other countries are not having these quarantines
Well,
requirements?
there is data that show that if you come from countries that were categorized as, for example, red, there are chances that you will test positive. Okay, during your quarantine, you actually caught the virus. Okay, so countries now are categorized into red, yellow, and green.
Green.
The Philippines is categorized as yellow. and depending on the categories, there is a required quarantine procedure. Okay, so it's like this. The incubation period for COVID-19 is 14 days, correct?
Yes.
Okay. So most countries will require RT-PCR 3 days before their flight, correct? Okay.
Yes.
So what if that during your test, okay, you don't show symptoms yet, so your test will be negative, correct?
Yes.
But you were already exposed, okay? So uh, during your flight, you're comfortable. Oh, I tested negative, okay? Because that was done at least 3 days before your flight. But what if you were already exposed? So that's the reason why there's a period wherein you will be quarantined. Because if you were exposed before you got your test, okay, symptoms will show up from that exposure up to 14 days after your exposure. So that's why when you arrive in the Philippines and you remain asymptomatic during your quarantine, as early as the 5th day from your arrival, you can already be tested. And if you come from a country which is tagged as a yellow category, then if it's negative, you're allowed to go home, but you complete the quarantine for a few more days. So a negative test doesn't give you, okay, any advantage of actually completing your quarantine. You have to continue because symptoms can appear up to 14 days after exposure. So that's the rule. It's not because the Bureau of Quarantine wants it, it's based on what we know about COVID-19. Okay, it's not based on the airline's protocol. It's not based from your country of origin. It's not based on the receiving country. It's based on science. That's why you have to get your quarantine. But of course, this is changing now, especially if you have proof of vaccination. So in the next few weeks, for example, we may see some laxity that if you get vaccinated, then just maybe you won't be quarantined anymore, okay, upon arrival. So let's see what happens. So there's a change happening, but let's wait and see what's going to happen because these are based on data that we continuously collect.
Dr. Eric, is Sinovac now accepted as proof of vaccination in the United States for people who may be traveling to the US? Because before it was not accepted as proof of vaccination. Is Sinovac now acceptable for people flying into the US?
That's one of the misinformation, okay? The vaccination will include all those that have been given an emergency use listing from the World Health Organization. And Sinovac is one of those vaccines that were given an emergency use listing. Okay? So there is confusion that if you get vaccinated, it will be your passport for entry. No. The question is, okay, this is the question of those in quarantine. What's the likelihood that you coming from the Philippines, for example, okay, will infect another person, okay, upon your arrival and during the next few days after your arrival, okay? So what you're going to show, for example, is a negative RT-PCR test. So that's one. It tells you that at least you were not infected, okay, when you traveled. And if you can show a vaccination certificate, okay, we're issuing that now. You can go online, vaxcert.ph, vaxcert.doh.gov.ph, okay. You can have your vaccination validated and you get a vaccination certificate, okay. So that is what you have to remember. Okay. So we're explaining this because many, aside from the booster doses, also wanted to get another brand of
Mhm.
vaccine for travel purposes. Please don't do that. Okay. So your what's important is that you get vaccinated, whether it's Sinovac or another brand, and that means uh, you have at least that protection that these vaccines will deliver. Okay.
Thank you. Polly, you may have two or three questions you want to ask Dr. Eric from our viewers.
Yes, follow up on my question on the minor vaccination, Dr. Tayag. Is there any recommended vaccine for 17 years old below, or is it the same vaccines given to the adults?
Yeah, practically it's Pfizer, Moderna. There are recommendations for Sinovac. Okay, so what's available for the adults is also available for the adolescent age group. Okay, and this will be explained because you have to have a signed informed consent. Okay, you have to be accompanied by a parent or guardian. There should be a medical certificate that attests that that adolescent has a comorbidity, and so that's what's going on right now.
Yeah, another question, Doc, from Fel in Telegando. She asked that she's already fully vaccinated last July. And is it okay to take other vaccines like the flu shot and the pneumonia shot?
Yes, if you must, especially if you are 55 years old and above for the pneumococcal conjugate vaccine. Except that there's a recommended interval of 14 days between these vaccines and the COVID 19 vaccine. Not because there's going to be an interference for the protection when you get these vaccines simultaneously, but because we are reporting adverse events following immunization. So if you get these vaccines together at the same time and you develop fever after 3 days of getting these vaccines, we don't know which one
Which one? Yes.
gave you fever. Okay. But there's one exemption. If you get bitten by a dog and you suspect there's rabies, okay, anti-rabies should be given. Okay, and you can still get the COVID 19 vaccine. So that's the only exception for the 14-day interval.
So
Okay,
what's
you
the
don't
best?
wait 14 days. Yes,
Okay.
you get vaccinated against rabies immediately, as recommended for treating animal bites from dogs suspected of rabies.
But with the flu and the pneumonia shot, Doc, is there any interval after your vaccination on COVID?
It's 14 days. So
14 days.
if you got flu vaccine first, you wait 14 days for before you get your COVID. If you got your COVID, you wait 14 days before you get your flu or pneumococcal.
Okay. There you go, Fel. That was your answer. And another question. With LGUs slowly opening borders with no more RT-PCR tests and just presenting proof of vaccination, do you think there will be another surge in cases the following months to come? This is from Kimiko.
I wish I have the answers. We don't know. There are many factors that will actually make this happen or not happen. So, are you wearing your mask? Okay. Are you washing your hands? Did you complete your vaccine doses? So, is a variant circulating in a particular area? Okay. Those sort of things. Okay. But of course, if you think that testing will be a thing of the past, no,
No.
because we want to know that if you have symptoms that it's COVID or not COVID. Okay? So if somebody, for example, complains of sore throat, so you cannot just think, is this COVID or not COVID? Because the stakes are high. If this is COVID, it has consequences.
So better
Okay,
get
the only way you get to find out if it's COVID is if you get tested.
But Doc, the RT-PCR test is very expensive.
That's why you can use the antigen testing. It's allowed now.
Okay.
Why I say
Antigen.
it's allowed now? So it's only if you have symptoms.
Mhm.
Okay. But if you're asymptomatic, you're exposed, RT-PCR is the test that's recommended.
I see.
So halimbawa, Polly, nahawa ako sa isang may COVID. Okay? So, after 5 days, wala pa akong symptom. Correct?
Yeah.
Okay. Pero alam natin, yung RT-PCR, after 7 days, wala nang kwenta, resulta. So, magpapatest ako ngayon. Okay? Wala akong symptom eh. So, you can do that between the 5th and 7th day after a known exposure. Okay? So, pag negative yon, kukumplituhin ko pa rin yung 14 days na quarantine. Kasi baka mamaya lumabas yung symptom ko. Tandaan nyo, every time you have a symptom and you suspect it's COVID, magpa-test. Okay. Iba ang procedure for our frontliners. There's random testing, there's regular testing. Okay, for their safety. So, ibang batas sa ospital, ibang batas sa community. Okay. Dapat malinaw yan ha. Kasi yung iba, baka nakakalimutan natin sa ospital, Doc Jun, lalo na dyan sa Iligan, yung pang-testing sa health workers, health providers, iba ang rules. Okay? Kumpara doon sa mga nasa community. Okay? Nililinaw natin yan.
Sir, let me add lang I think in a lot of hospitals here in Metro Manila, especially if they are admitting patients, since ang RT-PCR takes, at least mga 12 hours or so before they get the finding, and then they have to triage the patient, especially in patients who are not suspicious for COVID. I think what they do is they do the COVID antigen first, and if the antigen is negative, they also wait for the RT-PCR, so they could be triaged initially to a non-COVID bed, but if their RT-PCR turns out to be positive, then they could be switched to a different bed. But I think they do COVID antigen and RT-PCR both at the same time, so that when the antigen comes in an hour, then they could triage the admitted patient. So that's what I know as far as hospital policies.
Yes, pwede yan. Kaya lang the implications is that that's additional cost for the patient if you do that on a universal basis. So it should be risk-based. So what's the likelihood that this patient got exposed? What's the likelihood that when I do the test, the result will be like this? Okay. While that makes it easier for health providers, kasi automatic siya, you do both tests and make those decisions. But of course, this has implications on cost.
Okay, thank you. Polly, you have another question before I read another set of questions?
Okay, Doc Jun, please go ahead with the other sets of questions.
Okay, so Dr. Eric, this is more a question about immunity. There are diseases like hepatitis A and hepatitis B that confer lifelong immunity. Either you get infected or you got vaccinated. But there are also diseases like the flu, in which vaccination only gives you transient immunity. So at this point, as far as COVID-19, do we think that is it more like similar to the flu diseases rather than diseases caused by hepatitis viruses that could give you a permanent immunity once it's infected or vaccinated? I'm not sure if you already have the answer at this point, but maybe you do have an answer as far as the length of immunity, whether you got infected or you got vaccinated, because I guess we did mention before that if you got infected by COVID, you would actually expect if you had hepatitis B or A, you won't get it again. But it looks like people can be reinfected again by COVID, even if they already recover from their natural infection. Dr. Eric?
Well, for most people, you only not recover, but you can actually prevent another reinfection because either it's a natural infection or you got vaccinated June.
Mm-hmm.
But of course, this is not something that's cast in stone. Okay, there are studies that are ongoing and they're monitoring the protection that those who got the infection naturally. So many will report that at least 6 months, okay, there's a protection from natural infection. But of course, you cited earlier that for every infection, you actually boost the response for the immune system. So there are studies that want to confirm or not confirm this. And in fact, they're looking at the possibility that this may be the pathway so that this pandemic becomes endemic rather
Mm-hmm.
than these surges and outbreaks. Okay, so um, and I had to say it to everyone again. The data or information I shared to you earlier during my presentation may not be the same information because the information actually evolves. For example, I only mentioned the Delta variant, and now it's in the news. The United Kingdom reported a sub-variant of the Delta. It's the
Mm-hmm.
AY.4.2, and they're monitoring this because there are speculations that this might actually have an immune escape, meaning the vaccines we're using now may not offer protection against this sub-variant.
Mm-hmm.
Okay, so there is new information, and that's why everything is not cast in stone.
Thank you very much, Dr. Eric. So we hope that I guess we don't really expect to Delta to be the last of the variants, but we hope that by that time maybe we may have achieved herd immunity, and the vaccination is really protective of all types of variants.
Uh,
Now,
you know what, June? In fact, in many countries, they're not looking into this 70% or 80%
mhm,
as their threshold for vaccination, although many countries wanted 100%.
mhm,
A
mhm,
100%. The World Health Organization, for example, has sets its target that for each country to have at least 40%.
oh wow.
Okay, 40%. But let me translate that. It's the national, it's the countries, 40% fully vaccinated. So, for example, in the Philippines, fully vaccinated at 40%, it means that every province should reach 40%.
Yes.
Okay, so Iligan City should have 40%, and another city should have at least 40%. If you have more than 40%, that's good, but not one city, municipality should have less than 40%. Okay, you target that, and then you move on so that everybody gets vaccinated. But WHO has set 40% for each country, and they are fearful that we may not reach this milestone by the year ends. But the World Health Organization is hopeful that 40% is something that's achievable by year's end.
Thank you very much, Dr. Eric. This is actually great news because, I think everyone's fixated on herd immunity being at, I think initially was pegged at 70%. Then when Delta came, it became 80 or 90%, but it would be not achievable because that's supposed to be the total population, right? But we're not vaccinating the children. So you cannot really reach 100% if
And
you.
yeah, and it also causes frustration. Okay, when you look at your numbers,
Mhm.
oh, it's only 20%. But compare that if it's 40%, oh, we're
Mm.
halfway there.
Yes.
Okay? And so if you reach 40%, parang ganito yun eh. Okay, you want to lose weight. Okay? So when it was calculated, you have to lose 30 pounds. Okay? Even before you start your strategy for losing it, you're already frustrated. Compare it to if you just start, okay, can you lose 5 pounds?
Mhm.
Okay, di ba?
Yes,
Okay,
that's
then when
correct.
you lose 5 pounds, you add and add to it.
Mhm.
Okay, so that's how you do it in illegal. Okay, set it at 40. Then if you reach it,
Set the bar higher.
yes.
Okay. Thank you very much, Dr. Eric. As I think, as far as I remember, that from the figures that I see from different sources, I think right now the national figures around 20 to 25% are fully vaccinated nationwide. Is that correct, right?
Okay, the official calculation is the administered doses over the total population. So
Mm-hmm.
right now we are 111. I showed you in the stats, okay,
Mm-hmm.
that the first dose was 22%, yeah,
Mm-hmm.
25% for the second dose, that's 47%, okay, 40 for the country. But
Mm-hmm.
of course, what we want to look at is for each province, for each city. Okay. Parang ano yan eh, June, parang sa board exam o
Mm-hmm.
board exam, yung passing rate mo 75, pero
Mm-hmm.
nang tiningnan mo yung ano, meron kang 90, tapos merong
Mm-hmm.
bagsak, tapos nang
Mm-hmm.
tinotal mo, gano'n. So, dapat walang bagsak. Walang bababa sa 40. 47 nga, pero dapat lahat 40. Eh, hindi naman ganun eh. Okay? So, may mataas, may mababa. Dito sa Metro Manila, for example, how exactly do you count it? Kasi nag-open yung Metro Manila June. So,
Mm-hmm.
ibig sabihin, hindi lang taga Manila yung nabilang doon.
Mm-hmm.
Okay? May mga dumayong taga Cavite, Batangas, dito nagpabakuna. Remember, everybody works in Manila practically. So, hindi naman lahat yun taga Metro Manila. Okay? So, when you count it, akala mo mataas, pero hindi. Kaya nga nagkakaroon pa ng mga kaso eh. That's why we have to be very careful when we look at this data. So, ganun din ho kayo sa Iligan. So, ang population nyo, mga 300,000 ba?
370. 370.
370. Pero syempre, dahil urban center kayo, may dumadayo sa inyo na hindi taga-Iligan. Correct? So,
Yes, that's
easily,
right.
yung 370 nyo, 400, 420, depende. O, can you imagine? So, titingnan nyo yun. Okay? So, hindi mo siya titingnan sa context ng iligan. Okay?
Mm.
Itingnan nyo din yung mga taong dumadayo sa inyo transiently, kasi
Mhm.
siya nagtatrabaho. Ibibigyan nyo rin sila ng bakuna if the vaccine is not available in their permanent addresses. Okay.
So I think, sir, that was the reason why when the city of Manila released their figures, their percentage of vaccinated people is like 120%. So how can you reach 120% when the children are not even vaccinated? So you would not even reach 70%. So it was all these people coming into Manila getting vaccinated.
Yes.
Kaya
So,
lumabas ng 100%.
okay. So to validate that, ang pwedeng gawin yung barangay mag-census sa lugar nila. Okay. Knock on the door o sino pa sa inyo hindi bakunado rito. And I will not be surprised na meron pang mga hindi na bakunahan.
Mhm.
Okay. Di ba? 120% doesn't tell you anything.
Okay. The next question we have, Dr. Tayag, is about breakthrough infections. So breakthrough infections occur when the vaccines fail to provide protection against the pathogen they are supposed to protect, right? And as we know, for COVID vaccines, they may not really prevent you from getting the disease. They may prevent you from developing the severe disease. You can have mild disease. You could be asymptomatic, and you could even transmit the virus to somebody else. Do we have data in the Philippines if a certain vaccine has a higher rate of breakthrough infection compared to others? Kasi people are deciding, which is the best vaccine. So I guess breakthrough infections could probably kind of one of the criterion, but do we actually have data that one vaccine causes more breakthrough infections than the other? This is probably an interesting question.
Okay. If you go to the FDA website, there are adverse events reported every week. Okay. The FDA, I remember just a week ago, reported over 600 breakthrough infections. But of course, these are underreported. Okay? One thing, Polly, June, huwag kayong magkukumpara ng bakuna. Okay? Parang ganito yon. Binakunahan nga ako ng Moderna, naging pabaya ako, hindi ako nagmamas, hindi ako nagugas ng kamay. Okay? Patago ako nakikipagkita sa mga kaibigan ko. Mag-breakthrough infection ka nga. So, it's not as if pag nagpabakuna ka, it's in a vacuum that you do not consider all the other interventions that's available for you. Okay? So, if someone gets a breakthrough infection, don't blame it on the vaccine. Baka mahina yung bakuna, ganun. No. May kinalaman din halimbawa sa immune system mo. Halimbawa, pabaya ka, ninigarilyo ka, gano'n, ganyan. Ikat ka ba na bakunahan o hindi madali kang kakapitan? Okay? So, maraming factors yun. So, in as much as you, may mariming kayong report niya na mas konti ang breakthrough sa ganitong vaccine, ganito, ganyan, sinasabi ko na sa inyo, mga maling conclusion yun. Okay? What's important is, so kaya ang ginagawa nilang messaging is even if these breakthrough infections occur, there are studies that say na mas hindi raw nauospital. And then, pag gano'n naman yung message mo at may nagbalita dyan, bakit si anong ganito namatay? O, di ba? So, parang paikot-ikot yung istorya. That's why when you get vaccinated, okay, there's protection already. Okay? But it doesn't occur in a vacuum. So, titingnan mo yung risk mo. Halimbawa, bakunado ka. You work in a hospital. So, iba yung risk mo dun sa bakunado na hindi nagtatrabaho sa ospital. So, ano ba nang gagawin sa ospital? Diba? Mag-iingat ka pa rin. Bawasan mo exposure sa maraming patients. May rotation, may body ka para sasabihin sa'yo o may breach na sa infection control mo, sa PPE mo, gano'n. O kung ikaw naman ay nasa community, so nagpabakuna ka. Okay, more than 65 years old ka. Okay, so medyo kahit ka nagpabakuna, medyo pag ganun yung edad, baka iba yung immune response mo. So dapat mag-iingat ka pa rin. So titingnan mo yung risk mo. Di ba? So kahit ka nagpabakuna, hindi natin sinasabi na, kasi baka may mga pilosopo dyan na, ba't pa ako magpapabakuna, magkakaroon din pala ako ng infection. Mali. Because pag hindi ka nagpabakuna and you get the infection, nako, the results will be different. Okay? And we've seen many die. Okay? May namamatay pa rin kahit nabakunahan. Okay? Kasi huwag kayong mag-conclude kaagad. For example, may report nung isang araw, di ba? Inuna ko si Colin Powell. Okay? Ang binalita nila, 84 years old, namatay ng COVID complications, tapos may kadugtong, he was fully vaccinated. O di parang conclusion nun huwag tayo pagbakuna kasi si Colin Powell na yun, namatay pa ng COVID po, di ba? Pero hindi mo nakuha ang context, may multiple myeloma, si Colin Powell may cancer. So sa umpisa pa lang, kahit siya
immunocompromised.
Baka hindi tumalab. So wag mo ikumpara yung sarili mo doon sa ibang tao. Okay? Know your risk. Know your health status.
So that should be our message to those people who have vaccine hesitancy. Kasi marami pa rin yata tayo mga hesitant for the vaccine, right, Dr. Eric? So the outcomes could be different.
may marami nga nagtatanong sa akin, Polly at June, may karapatan ba silang tumanggi sa bakuna? Okay? Kasi sa Amerika, ginagawa nilang mandatory to at marami nagpro-protesta. Okay? Number one, may karapatan ng bawat isa sa atin na magpabakuna o wag magpabakuna. Decision natin yun. Pero sana ang asa namin ay informed decision po yun. Okay? Hindi yung nahaluan ng decision yun ng mga fake news at misinformation. Pero kung ayaw nyo talaga magpabakuna, alam nyo na pwedeng mangyari kung hindi kayo magpapabakuna. So, dapat ingat po tayo. O ngayon, tatanungin nyo yung iba, may karapatan bang maging mandatory yan? Okay? Alam nyo, maraming mga ethicists. Okay? If it is for the common good, bakit hindi? Okay? Controversial yan. Kasi lahat na nagpabakuna tapos ikaw hindi nagpapabakuna, then you are going to put others at risk. Okay? Kaya nga sa Amerika, di ba? Pag hindi ka nagpabakuna, you lose your job. Okay? Eh, syempre, mag-aaway yung human rights daw. Sa isang ospital, gusto ko ikwento sa inyo, nagreklamo yung mga nurses doon sa Amerika, napunta sa korte. Ang sabi ng judge, sumunod kayo sa patakaran ng ospital. This is not about yung paniwala nyo sa vaccine. This is not about na pinipilit kayo sa vaccine. Pumirma kayo ng kontrata sa ospital na susundin nyo yung policy nila. Nagkataon ng policy nila, dapat kayo bakunado. So, dahil hindi kayo bakunado, may karapatan yung ospital na tanggalin kayo sa trabaho. At kayo naman may karapatan maghanap ng trabaho kasi ayaw nyo magpabakuna. So kung ayaw yung patakaran doon, di maghanap kayo ng ibang trabaho. Yun ang sabi ng judge. So magiging ano pa yan, masalimuot, Polly, June. So we hope hindi tayo humantong dyan. Okay. 7 billion na yung ang dami nang nabakunahan sa buong mundo. So kung may masama rin sa bakuna, hindi pwedeng hindi makover yun ng media sa atin, lalo na sa atin.
That's right.
Pero syempre, i-respeto pa rin yung karapatan nyo. Kung ayaw nyo magpabakuna, wag. Halimbawa, yung buntis, di-delay niya kasi gusto niya second, third trimester. So karapatan niya magpabakuna. O yung mga bata ngayon, immunocompromised, o kaya nga may form consent. Kung ayaw niyong pabakunahan, di alam niyo na yung gagawin niyo. Okay? Pero sinasabi nga na pag nabakunahan na tayong lahat, sino bang hahanapin ng virus? Di yung bata, yung mga adolescent. Kaya yun ang argument nila, kaya inuunahan nila.
Okay. Thank you, Dr. Eric. Polly, you have may mga questions ka pa yata, no, from our viewers. Go ahead, Polly.
Okay, I'm just gonna read maybe 3 more questions. This one came from Marilu Reyes. Doc Tayag, what are the available treatment for COVID?
Okay, kanina binanggit ko sa inyo na practically wala pa tayong treatment, pero sa Amerika, yung FDA, inaprubahan yung remdesivir. Okay? At ngayon, yung MSD maglalabas ng molnupiravir. Pero tinitingnan nila kung sa November 30, mabibigyan to ng emergency use listing. Okay? Para sa virus kasi yan eh. So, hindi pwede antibiotics. Okay? Pag na-hospital ka, may mga protocol. Okay? May living guidelines, yung mga medical society sa ating bansa. Nililista doon yung mga ginagamit na gamot ngayon. Siguro patungkol yan, hindi na lang yan diniretso. Pwede bang uminom ng ivermectin? Okay? So, kasi mababasa niya na treatment siya, ganito, ganyan. Sa ngayon po, ay hindi matibay ebidensya sa ivermectin. So, maraming bumibili niyan online kung ano-anong diskarte pag inom ng ivermectin. Okay. Meron mga uminom ng ivermectin, gumaling. So, sasabihin nila, ay, ang galing na ivermectin. Marami talagang magko-COVID, mild lang eh. O paano mo masasabi na yun ay sa ivermectin? Baka nagkataon lang kasi mild lang yung illness mo. Okay? At pag uminom ng ivermectin na ospital, ang conclusion naman, palpak naman tong ivermectin. Kaya nga, huwag niyong gawing eksperimento sarili niyo. May gumagawa niyan ng studies. Hintayin natin resulta. Okay? Yung iba, lingwa. Yung iba, nagtutuob. Dito sa atin, tawa-tawa. Virgin coconut oil. Okay? Di ba yung gamot sa malaria noon, di ba, pinagkaguluhan. Oo, di ba? Hydroxychloroquine. In-endorse pa yan ni former President Trump. Tapos wala pa lang everybody gets excited. Ganito lang kasi yung pagtuklas sa gamot. Kesa mag-invento ng bagong gamot, tingnan natin yung mga gamot at i-repurpose natin. Kaya tulad yung gamot sa malaria, gano'n. Yung ivermectin, parasitic, tignan natin, gano'n. So, isa yung paraan. Yung iba naman, yung pangalawang paraan naman yon, magtuklas tayo ng bagong molecule. Ito naman yung molnupiravir, gano'n. So, gano'n yon. Kaya lang, kailangan pag-aralan yan. So, hindi lang yung kumabisa yan, kundi kung ligtas. Baka mamaya mabisa nga, hindi naman ligtas inumin. Okay. So, yung molnupiravir, nag-announce yung MSD kasi $700 yung starting price sa Amerika. Kung yun ay maaprubahan, titignan nila na baka hindi naman ganun kataas yung presyo dito sa atin. Okay.
Thank you. Last question from my side. How long is the effectivity of COVID-19 vaccine? You mentioned earlier, Doc,
okay, hindi ko masasagot yan. Pero dahil sa nag-ano sila ng booster doses na sana wala namang kinalaman sa vaccine, kundi sa immune response na isang individual. Sa ngayon, maaasahan yung bakuna ng 6 to 10 months, pero hindi natin masabi kung yan ay matutulad sa influenza vaccine na kailangan mo ibigay taon-taon. So, ngayon, yung iba nag-aargumento, ba't pa ako pagpapabakuna? Taon-taon pala uulitin yan. Okay. Kasi po, pag hindi kayo nagpabakuna, ang kapalit po nun, pwede kayong magkasakit. Kung nagtiyempo kayo yung ospital, katulad dyan, nangyari sa Iligan, kulang yung ventilator. Okay, wala na ko yung mapupuntahan. Ang taas kaya ng case fatality rate nyo, 4.5. 3 times the national average. Buti nga, nagawa ng paraan nyo dyan sa taga-Iligan na mapababayan. Biro mo, less than 1 na lang ang namamatay. Araw-araw ba? Ang gandang mga numero yan. Sana magtuloy-tuloy pa. Sana wala nang mamatay po dyan sa inyo.
We're praying for that.
Do you have any more questions, Polly, from your side?
Nothing from my side anymore, Doc. Jun.
Okay. Dr. Eric, I have a few more questions here, but they're not as, they're not as thought-provoking or hard compared to our first few questions. So ito naman, this is more very practical. What is the evidence for or against the use of the following? HEPA filters, home air purifiers, ionizing filters, UV lamps. Maraming nag-ano dito, nagpo-promote sa Lazada or sa Facebook.
Okay. Doon sa binanggit mo, ang maganda lang yung evidence, HEPA filter. The others, kung may sobra kang pera, sige, bilhin mo, pero get vaccinated. Okay? Ang dami ko nakikita niya, may quintas.
Yes, that's
nagbibigay rin sa akin yan
Sinusuot niyo, sir? Sinusuot niyo?
Ba? Ayan, wala. Tapos yung may UV light, wala po.
Wala, okay.
Laging mabili yung UV light. Okay, kasi may box pa, merong parang wand, may malalaking ganyan. Ang merong evidence lang yung HEPA filter.
Okay, thank you very much. Ito naman, this is also a practical question. Although we know naman na COVID-19 is really transmitted through droplets, but it also can be transmitted through fomites, di ba? So right now, ang daming tao nagpapabili sa Lazada, Shopee, mga food deliveries, and they're getting these packages. So what can they do para hindi sila takot sila, baka mahawakan lang, may virus dun sa package. So,
kung natatakot pala kayo, ba't kayo bumibili?
okay. Good point, good point.
Okay. Ganito ho yun. Dati, sinabi nila dahil droplet yan. So, inorasan pa nga nila kung gaano katagal nabubuhay yung virus sa surface. May 8 hours, may more than 8 hours. Tapos natuklasan nila, hindi yun ang main mode of transmission. Okay? Pero syempre, may potential na pwede tayong mahawa dahil sa hinawakan natin contaminated na yan. Okay. Kaya nga pag may face shield ka, malamang sa hindi mo maproprotectionan ka, di ba? O kinamot mo yung kamay mo, yung mata mo, sinundot mo yung ilong mo, pinasok mo sa bibig yung daliri. Nagkataon na may secretions yun, na meron pang buhay na virus, so mahawa ka ron. Especially yung mga nandun sa ospital. Otherwise, yung mga binili nyo sa may balita pa akong ganito ginagawa eh. Pag na-deliver, nobody touches it. Maghihintay ng 24 hours. Tapos bago buksan, i-spray. Okay. You don't get COVID like that. Okay? So, hindi kayo dapat matakot na pag may binili kayo, okay, damit yan, okay, may virus yun, baka kayo mahawa. Okay? The least that you can do is that pagka hawak nyo doon, wash your hands.
Okay. Thank you. Good advice.
Safe ka sa online shopping, Doc. Safe sa online shopping yung tip mo.
Hindi ako na inganyo dyan sa online shopping. Kasi ang gusto ko yung nahihipo ko, nakikita ko talaga. At marami na frustrate, di ba? Maganda mo nakita pagdating sa'yo. Ano to? Iba sa expectation mo. Pero iba, sanay eh. Kasi may mga rating naman yung mga online sellers yan na quality naman. Pero ako hindi ako na hindi ako na hook sa mga online. Okay. I don't know if that's good or bad.
Okay. Thank you, Dr. Eric. So I think we have our last question, and we really want to accommodate all of your questions, but we have a limited time. So for our last question na lang, maybe this is something that maybe a lot of the viewers can learn. Tell us about long COVID. What are the side effects or what are the affectations on different organ systems? Kasi we do know people, they recovered from COVID and they still have cough, they still are very weak, kailangan i-rehab. So maybe we can ikwento natin sa mga viewers natin what is long COVID as our last question.
Okay, this is started as observation and they found out to as many as 30% than sa United Kingdom. Ang kagandahan kasi noon sa United Kingdom, pag meron kang COVID, you have to report your symptoms as they appear. So napansin nila doon, sandali muna. Months na to after their acute illness, but may symptoms pa rin to. So, tinabulate nila yon. May 200 na symptoms ang nailista nila months after you recovered. So, tinawag nila itong long COVID. Naging controversial yung term na yan. Hanggang just 2 weeks ago, they finally had a consensus kung ano ang long COVID. Number one, it should these symptoms should happen at least 3 months, okay, after you recover. Okay, nandiyan pa rin yung symptoms. And number 2, it will last not fewer than 60 days. Okay? So long COVID yun. Ibig sabihin persistent. So ano yung mga symptoms na to? Ang most common ay fatigue. Yung para bang ayaw mo nang bumangon sa bed. Number two, yung iba nagkakaroon ng brain fog. They have difficulty on concentrating on things that you have to do every day. Yung iba nagkakaroon ng palpitations, yung iba tumataas yung blood sugar, nagkakaroon ng diabetes. So more than 200 yung symptoms. But what is common dito sa long COVID is that it's the persistence of symptoms. Okay? At ang dito sa ating bansa, yung cough at saka shortness of breath, yun ang nirereklamo. Sana ma-report po natin yan at hindi kasi nare-report yan eh. Pag nagka-COVID na, parang tapos na ako dyan. Hindi. Maraming nagkaroon ng COVID hanggang ngayon may nararamdaman. Iba na yung katawan nila. The worst condition sa long COVID ay yung iba, ang sabi nila, complication, pulmonary fibrosis. Ang treatment nila ay kailangan mo ng lung transplant.
Okay.
Okay, so yun. So malungkot.
Thank you, Dr. Eric, for the patience and the enthusiasm in answering all these questions. So may we ask you for your last words, a message of hope and encouragement, not just to the people in Iligan, but for the entire Philippines from Apari to Jolo.
Okay, sana mabisita kayo dyan sa Iligan kasi kayo ang may masarap na tinatagong sekreto dyan sa lechon. Okay, alam niyo na kung anong lugar dyan sa Iligan. Pag sinabing Iligan, yun ang kagad na nasa isip ko, naku, may kakainin ako masarap na lechon. Pero sa ngayon po at kayo ay nagiging successful para bumaba pa yung mga kaso nyo, be vigilant. Okay? Alam nyo na tumaas po yan, nahirapan kayo. So, ngayon na meron na kayong laboratory, make that opportunity na yung kailangan magpa-test, na papatest para ma-quarantine, ma-isolate ka agad. That's the only way na mababawasan pa natin yung maaaring magkaroon ng COVID-19 at maaaring mamatay. At gandaan nyo po yung inyong contact tracing. At sa bakuna nyo po, kung sa tingin nyo mabagal yung dating, mag-ingay kayo, magreklamo kayo para sa ganun makuha nyo yung bakuna. Kasi pag iniintay nyo lang darating yung bakuna, wala akong pa yung bakuna. Hindi maglalakad yung bakuna sa Iligan. So, kailangan mag-ingay kayo. Give us that vaccine. Karapatan nyo kung humingi ng vaccine. Ayan, yan po ang mensahe ko sa inyo.
Thank you very much, Dr. Eric, for those words. Again, daghay salamat for accepting our invitation for you to be our speaker. So I think we have reached the end of our webinar. And I think we are all indebted to our organizers. And let me mention the people we will be thanking. Okay, let's start with the organizers, Newtech Pulp Incorporated. Congratulations. It is a private company that is very generous to organize this huge information campaign for Iligan City. Very rare to find a company like that with such much community service. Okay, NPI is represented by Miss Polly Valera de los Santos. We have Kat Echevarria, si Ma'am Petra Borsha, and Engineer Albert Munyaski. Thank you, guys. To our webinar production staff naman, we thank ThinkBox Production under Roy Dumagin and the staff, si Rainiel Rimo, Marlon Mijares, and Raymond Escarin. We would like to thank our videographer, si Reg Frejas, and we thank the Department of Health and the Medical City for those videos we showed during the countdown. We also thank the following persons for helping to promote this webinar event. Congressman Freddy Shao, Ms. Angeli Echeverry, Engineer Butch Ruiz, Alan and Mitos Lagtapon Shao, the Iligan City Chamber of Commerce, headed by Ms. Reggie Punong Bayan. So palakpakan nato tanan ang mga all these people for all your contributions. Mga Iliganon ug buong Pilipinas, thank you, daghay salamat for joining us. Be safe everyone. Laban tayo Pilipinas. This is Dr. Jun Ruiz signing off.
Thank you.
Thank you everyone. Bye.
June, thank you.
Bye.